Michigan. So I've done what is one of the oldest implants that I've done that I can recall from 1972. So these are 52-year-old set of silicone breast implants that the patient had. She is 80 years of age, 80. She's 80. She's been cleared by her doctors. And so she comes to me with a hard ball mass on the right and also on the left. 52-year-old set of implants, one set. So as you can see, I removed the excess skin. There was a lot of inflammation. Now, the imaging that she had showed what was a snowstorm appearance and what was externalization of the silicone. So there's a lot of inflamed tissue, as you can imagine, around. And if I touch this tissue, it's hard, irregular, and abnormal. And so I've had to remove all of this tissue because just removing the capsule alone is not sufficient because the silicone has spilled over into the periphery. So as I touch this, this looks abnormal, palpates abnormal, feels abnormal. Hence, it was incorporated along with what is the N block, 6/20/24 initials LS. Nice lady from out of state. So as you can see, like an eggshell, if you will, relatively hard. So what I'm going to do is I'm going to go ahead and cut this open. First, I want to go ahead and cut through this so we can see. Because remember, this is what I was dissecting through all this time. And as I go in, this is, if you look at this tissue, this is dusky, abnormal fat. That's basically abnormal. It has the inflammation in it. And as I palpate, remember, we're always thinking of malignancy as well. And so, I want to remove everything that is abnormal. So as I go in, I'm going to go in from this level. There's less calcifications. Remember, this is the gold standard end blocks. There is no other better way of doing the surgery. No need for drains. Everything was contained. And as I go in right here, you will see how suffocated, if you will, the implant is. Everything is contained. And as you can see, it is very calcified. I'm going to go in here. All the badness contained. I'm going to go in. You can see how the implant is literally folded on itself. 52 years later, is it now coming out? She had imaging done, and as you will see, this is your very old set of implants, older technology. And just like the near cohesive ones, they rupture. This is certainly very much ruptured, just the sheer length of time that it has been present. Now, if I open this up, I will go ahead and remove this implant out of this shell, if you will, literally. And you can see how everything is contained. And I'm going to now go ahead and invert this so we can see literally, it's like cement, if you will. 80-year-old lady, she does not have to be living like this, and she's lived like this for decades. You can see what's coming out, hard like a ball, and you can see, look at this, this is all embedded, and in the periphery, all of this tissue, calcifications, whatnot else. You can imagine every turn that she took in the bed, every hug that she gave, all of this tissue, it's like plaster was there. Now, what I want to do here is I want to actually cut this open just to be complete. You can see what I'm trying to show here is this is the ruptured silicone. So this is the take-home message. Someone will say, well, just remove the capsule, not good enough. Look at this tissue. This is all dusky. This is bad, inflamed. It looks like fat necrosis. And if you look over here,
There's silica that has basically embedded within the tissue. So all of this tissue has to be removed. There is no point just removing the implant and the capsule, leaving this behind, because now you're going to leave all of this bad tissue behind. So that's why all of this was incorporated. Now, if you touch this, you will feel irregular masses. This is that snow storm appearance that you see right here within, and very hard. Look, this is that soft tissue. I'm going to cut it. I'm hurting my scissors as I do that. Just look, you saw this. This is all silicon granulomas. Um, Look at all of this. This is silica right here. So all abnormal. So I'm going to go ahead, and what I'm going to do now is I'm just going to remove my top gloves. So I have another pair of sterile gloves at the bottom. So I don't want to cross contaminate in case I find some abnormal fluid. This is the left side. I removed the excess skin as I marked. And I just want to highlight, look at these abnormalities right here. As I was dissecting, same thing, the snowstorm appearance. And this is that abnormal tissue. What I'm going to do is I'm going to dissect this off. As I dissect this off, you will see this inflamed tissue right here. Lot of irregular masses. I'm going to go ahead and cut this out as well. And we can see a lot of inflammation here. So I'm going to go ahead and go in. Let me find a good entry point, which is going to be right here. So after 52 years, half a century, over half a century later, both ruptured. I'm going to go ahead and open this here. You can see the much older technology. It has this mesh type of an appearance right here. I'm going to pull this out. All of this was contained. None of this spilled into the chest. No need for the drains. Look at this, has this Mickey Mouse ears. And so I'm going to go ahead and flip this around. And again, you will see it's very hard, like the scales of a fish. If I show the back of this, it's like a rock, literally. And what I want to do is I want to cut this open. Remember, for I've been dissecting around this all this several hours, and you can see how dusky and abnormal that fat looks. It has this gray yellow appearance to it. Let me cut this open right here, this tissue. You can see right here, there's a pocket within the pocket. Uh, See right here, if you look at the pocket, and all abnormal tissue. So as you can see, not healthy. Implants are not safe. If you look at this, this looks less of a volume than when it was, because very likely it has leached into the periphery. So end block, the gold standard, no other better way. 20 years from now, I cannot imagine anyone else removing the implants in any other way. No silicone spilling into the chest, no abnormal inflamed tissue being left behind. No need for drains. This is how well the surgery went. No need for the unnecessary lift. She had great core contracture right and left. No need for the unnecessary lift. No need for the drains. Uh, Twilight sedation. She has had
The capsules will be sent to pathology, rule out the BIA, ALCL, CD30 analysis, rule out lymphoma, rule out malignancy, cultures for Arabic and fungal. The implants will be returned to the patient so that she has closure as to what was inside. She will get the high definition pictures and videos if she wants. And then this is where all inflamed tissue has been removed, and now we will see post-op how she does. Certainly, she will not have the pain on her chest. That alone is a plus. No one should be living with ruptured silicone implants. It's not safe, and we'll see more importantly what the pathology is. And there you have it. Implants are not safe. The newer set of implants, the gummy bears, rupture in a similar fashion as the old ones done, as we have seen many times in the many Facebook Lives. Please share. This is Dr. Khan, Executive Plastic Surgery.